What comes in 4 binders, has 5 sections, and will be reviewed by 4 different appraisers. By the way, it can't be any more than 15 inches tall. It is the Cone Health Magnet Redesignation. That story and more in this month's Code View. Sarah Lackey calls it a 2-year marathon. That's how long she and a core team of people from across Cone Health have been compiling information for the Cone Health Magnet Hospital's redesignation application. The application only has 66 questions, but it's the answers that will get you.
I think 20 pages of narrative is my longest. That's just writing single-spaced, page after page after page. And then the evidence behind that, of course, that's going to depend on the complexity of the item. But I've had as many as 20, 25, 30 evidence items that are attached on the end of that. So that's a 60-page item.
Lackey tracks the progress of gathering information for this massive document using nearly every vertical surface in her office.
Magnet is a big honor. So anything that's a big honor ought to be a struggle, ought to be something that's worthy of some hard work.
This phase of the project ends when the application is sent August 1st. It'll be 3 or 4 more months before we are told when Cone Health has earned its site visit. Cone Health Heart and Vascular Center passes another major milestone. It has become the first non-transplant center in North Carolina to implant a left ventricular assist device, or LVAD. This small pump attaches to the heart and takes over the work of the heart and circulating blood. The devices are used for heart failure patients. That is a growing population.
The treatment of advanced heart failure has improved over the years, but for the extremely advanced patients, other than transplantation, there is not much new available until this technology with the ventricular assist devices came along.
The Heart and Vascular Center implanted its first LVAD last month. Teens have a place for health care. Many have lost touch or feel too old to go to a pediatrician, and often they aren't old enough to be seen by an internal medicine doctor. That leaves the Adolescent Medicine Clinic at Cone Health. It is not only a place for teens, but a great opportunity for pediatric and family medicine residents.
You'll have an adolescent with different sorts of acting out behaviors or school failures or problems getting along with their parents or drug use, early sexuality, things like that, that suddenly seem like they escalate to the point that the family practitioner or the pediatrician would like a consult.
For now, the clinic is only open Thursday afternoons. You can make an appointment for your teen by calling 832-7867. Mark your calendar for the 21st Women's Only 5K Walk and Run. The fundraiser that makes it possible for women to get a mammogram who might not otherwise be able to afford one is October 5th. The walk and run begins at 9:30. Last year's event attracted 3,700 participants. You can register by going to womensonlyrun.com. The Cone Health Alamance Regional Medical Center merger looks like a great way to expand services, improve quality, and lower the cost of care. While many questions remain regarding logos, uniforms, benefits, and payroll, Code View decided to look at the bigger question. What 3 things should every Cone Health employee know about Alamance Regional Medical Center? Hospital President and Chief Operating Officer Preston Hammock says the list starts with being a full-service hospital.
And we're very proud of that wide variety of offerings, everything from a comprehensive community cancer program to outpatient imaging to vascular services, really a complement of services that's broader than most people think.
Leading edge technology is also something important to know about the 238-bed hospital. Alamance Regional is a Siemens beta site, which means it's the first installation for much of that company's imaging equipment. Hammock also wants you to know that the 2,250 employees of Alamance Regional Medical Center are all about community.
We are a community-driven, mission-based organization so that we strive to plan every year on the services we need to continue to develop based on what's needed here by our patients in our community.
Sounds like we already have a lot of things in common. That's it for Code View. I'm Doug Allred, and we'll see you next time.